Hello everyone, this is Dr. Nupur and I'm a consultant ophthalmologist practicing in Bicholim, Goa. Today, let us bust some myths related to cataract surgery. So point number 1, cataract surgery can only be performed once the cataract becomes ripe. So this is a misconception. In fact, cataract surgery has to be performed once the drop in vision due to cataract starts interfering in your day-to-day functioning. Point number 2 is that cataract can recur even after cataract surgery. Now this is a complete myth. In fact, whenever we perform cataract surgery, we replace the cataractous lens with an artificial intraocular lens. So cataract can in no way recur once the surgery is performed. However, you can get something called as an after cataract, which is also called as posterior capsular opacification, and this is treatable by a simple OPD based laser procedure. Point number 3, people believe that cataract surgery is a painful procedure and that the post-op recovery takes months. So again, this is a complete misconception. Cataract surgery, in fact, is the quickest procedure, and modern techniques of cataract surgery such as phacoemulsification can now be performed with the help of only drops, that is no injections required. And the post-op recovery is so quick that a few patients can get back to their normal routine even after few days of surgery. Point number 4, and the most important one, is that there is a belief that cataract occurs only in the elderly. So again, this is not true. Nowadays we see cataracts occurring in even the younger age groups such as the ones in 30s, 40s and 50s. So cataracts can occur depending on the patient's lifestyle, the patient's nutrition status, whether the patient has diabetes or no, whether there is any history of trauma, or whether the patient is on any long-term medication such as steroids. So all these factors contribute to development of cataract. So in case any of you are experiencing symptoms of cataract such as blurring of vision, having difficulty in night driving due to excessive glare, or perceiving colored halos around lights, please visit your nearest ophthalmologist, and if they suggest surgery, kindly do not delay the procedure.